We want to spend £450 million to improve acute hospital and maternity services in Leicester, Leicestershire and Rutland. This means the services provided at the Leicester Royal Infirmary, Glenfield Hospital and the General Hospital. We want to see improved patient care, better patient outcomes and have staff working in the best place to make this happen. Most of all, we want to deliver hospital healthcare that is fit for the future. This is your chance to find out more about what is being proposed and to have your say. This will help your local NHS understand what the changes would mean for you and help us make a final decision.
What we don't want is a health service that's designed only by the people who work in it. It's got to be designed by the people who experience it and use those services.
The proposals include 2 super intensive care units, one at Leicester Royal and one at Glenfield Hospital, with 100 beds in total. That's almost double the current number. Modernised wards, operating theatres and imaging facilities. The first dedicated single-site children's hospital in the East Midlands, based at the Royal. And a new maternity hospital. Currently there are 2 units on different sites, the General and the Royal.
Obviously having 2 sites means that sometimes we're spread too thinly. When we're really busy, when we haven't got enough rooms or when we haven't got enough staff to look after the women, especially in labour, women need one-to-one care, we have to transfer activity from one site to another. So we would envisage that with a new larger hospital where we've pooled the staff together, that likelihood would happen less often. The beauty of it is that they're going to be in one unit, and if there is an emergency situation, they can very quickly have access to the obstetricians and the neonatologists.
Under our proposals, Glenfield Hospital will become a major planned care treatment centre, with welcome centres to put you at ease and help you find your way around the hospital. These changes would enable us to separate emergency care and planned operations. This would help prevent treatment being delayed or cancelled when the emergency services are busy. More than 100,000 day case procedures and around 600,000 follow-up appointments take place every year at the city's hospitals. The move will free up capacity at the Leicester Royal Infirmary and help ease issues of access and parking there.
Let's take a patient, for example, who's having a planned daycare surgical procedure. They will receive their pre-operative workup on this site, so all the tests and things they need doing before the operation. They will have also been seen in clinic on this site to have the decision made that they need an operation in the first place. Then they'll come to this site, they'll have their operation and go home the same day, and any follow-up that's necessary after that will also be provided on this site.
Leicester General Hospital will become a community health campus. It would include facilities such as the Diabetes Centre of Excellence, a dedicated imaging hub to help GPs diagnose patients' conditions quicker, and a stroke recovery service with inpatient beds. It would potentially be home to a midwifery-led unit, which will be relocated from St Mary's in Melton Mowbray. This will make it accessible to more people and provide a better and safer experience for mums. Today's modern medicine and technology means many patients don't always need to stay in hospital to get well.
Over the last 30 years, the NHS has cut its beds by about 50%, which feels counterintuitive looking at the population growth. But when you take into consideration the change in medical practice over 30 years, so hip replacements used to come in and be in hospital for over a week. They're now staying in hospital for around 2 days. We've got sort of robotic surgery now and keyhole surgery, which means patients don't stay in hospital as long. And we used to prescribe bed rest for patients. We don't do that anymore either.
And for some conditions, you can be cared for at home or where you live.
If you need to be in hospital, so you need treatment or you need investigations that can't be done in the community, or for instance you're acutely unwell and you need the investigations doing straight away, hospital is the right place for patients. But there's certainly patients where their medical treatment can happen at home, and it's much nicer for the patient if you can have all the care investigations done in your own surroundings, done at local community hospitals with doctors, nurses coming in that will be the same faces that they see on a daily basis. It's about having safe care, but in the best way for the patient, the most suitable way.
At the moment, our hospitals and our staff, while doing their best, are spread too thinly, trying to provide 21st century services in outdated buildings with limited resources and opportunities for change. We want to achieve a service based on our future healthcare needs, not the legacy of the past.
Leicester's hospitals merged in 2000, and whilst that merger was very successful, it left one issue unresolved. And that was that many of our clinical services, the location of those clinical services is more a product of accident than design. They're split across more than one site. Our staff are spread thinly and our equipment isn't always in the right place. And that can lead to difficulties with staffing our services in the way that we would want to do optimally. I'm really excited by these changes. I think that this is a once-in-a-generation chance to provide care in Leicester, Leicestershire and Rutland that will be state-of-the-art, will give patients a much improved patient experience, give them access to modern medicines, modern treatments in modern buildings. And I'm really excited by this, and I hope that people will be when they see the plans of what we're planning to try and do for Leicester, Leicestershire and Rutland.
You can see the proposals on our website and fill in a questionnaire to give us your views.